So we'll go to the next presentation by Sonia, Rachel, Thomas. Analysis of outcome of patients undergoing trabeculectomy at a tertiary center care, 1-year follow-up.
Good morning all. My topic is analysis of outcome of patients undergoing trabeculectomy at a tertiary care center, a 1-year follow-up. Trabeculectomy is the established gold standard of surgical treatment for glaucoma, and it has gained wide acceptance because of its higher success rate and low rate of serious complications compared to other procedures. But still, there are very few studies that are available regarding its success rate and type and frequency of its complications. So, the aim of my study was to compare the results of intraocular pressure reduction between trabeculectomy and phacotrabeculectomy group and to analyze the complication rates and the frequency of postoperative interventions. And ours was a retrospective study conducted during a period of May 2021 to May 2022, and case records of the patients who underwent trabeculectomy and phacotrabeculectomy during this period were analyzed. And we took 69 eyes of 65 patients, and all the surgeries were performed by a single surgeon. We analyzed the patient demographics, visual acuity, preoperative and postoperative, and preoperative and postoperative intraocular pressure, postoperative complications and interventions. And we included primary open angle glaucoma and angle closure glaucoma along with normal tension glaucoma, and we included pseudo exfoliation glaucoma. But we excluded the patients who lost to follow-up during this period and other secondary glaucomas. And coming to the results, out of 69 eyes of 65 patients, 42 were males and 27 were females. And all were in maximum patients were included in the age group of 61 to 70. And maximum diagnoses were primary angle closure glaucoma and least being ocular hypertension. And out of 69 patients, 69 eyes, 40 underwent phacotrabeculectomy and 29 underwent trabeculectomy. And we compared the preoperative best corrected visual acuity. Phacotrabeculectomy group had a visual acuity from 6'9" to counting fingers 5 meters, and the trabeculectomy group had a vision from 6/6 to 6/60. And postoperatively, we found that out of 40 patients, 37 patients in the phacotrabeculectomy group reached a 6/6 vision, but 3 out of 20 patients reached a 6/18 vision in the trabeculectomy group. And coming to the secondary interventions, out of 40 patients, 52.5% of the phacotrabeculectomy group underwent secondary intervention, and only 20% underwent secondary intervention in the trabeculectomy group. And most of the interventions were done within 1 month of the postoperative period. And the maximum intervention was done, it was suture lysis in 14 patients. And regarding the anti-glaucoma medications, out of 69 eyes, by 1 year, only 7 patients were started on with anti-glaucoma medications. And in terms of intraocular pressure, postoperatively, there was a slight increase in the intraocular pressure in the phacotrabeculectomy group, but by the end of 6 months and 1 year, it was similar in both the groups. So coming to the discussion, so our study showed that there was a significant reduction in the IOP from 23 to 10 by 1 year. And study conducted in Turkey also showed that there was similar reduction in the intraocular pressure. And in the phacotrabeculectomy group, 8 patients were phaking and all underwent phacoemulsification. And 2 versus trabeculectomy group also showed that patient received phacoemulsification within 2 years. And preoperative visual acuity was worse in the phacotrabeculectomy group, and it got better after the surgery. And it was also similar in Park et al. Study. And 15 patients of the phacotrabeculectomy, more patients were started in the phacotrabeculectomy group were started on with anti-glaucoma medications, but only 1 were started on with anti-glaucoma in the trabeculectomy group. It was similar to Choi et al. Study. And the post-operative interventions were more in the phacotrabeculectomy group in our study, and it was similar to other study conducted by Gede et al. So conclusion, trabeculectomy is the gold standard of the patients with progressive glaucomatous vision and uncontrolled intraocular pressure. So our study suggested that both trabeculectomy and phacotrabeculectomy resulted in effective reduction in intraocular pressure, and trabeculectomy was found to be better in terms of long-term intraocular pressure reduction and the frequency of postoperative complications compared to phacotrabeculectomy. These are my references. Thank you.
You said why phacotrabeculectomy has poor outcome in IOP outcome?
Sir, we came to the conclusion that because we do two procedures at the same time, like cataract extraction along with trabeculectomy, so there may be a chance of more inflammation. That may
But
be
actually, if you remove the cataract, the iris diaphragm goes down, no? It
but
should actually, there was a time when lens removal was supposed to be a treatment for angle closure glaucomas. So here, most of your cases are PSEG, but in spite of that, when the lens is removed, the IOP reduction is a little less in your studies. Any other possible reason?
Sir, like we came to the conclusion because of the inflammation, because of the added inflammation, and it was similar to a result by another study in Gede et al.
Actually, this is something like a clinical audit. You have done a clinical audit of your hospital that 1 year period. Everyone knows that trabeculectomy has success rate of this percent for many years. So it's a clinical audit sort of thing. It's not, no real message from the studies. So that is why I was telling each case you should see the. Probably you could have done one thing. How many patients are continuing anti-glaucoma medications?
7.
After surgery also? 7 patients.
7 patients started within a period of 6 months.
In that, more are
phacotrabeculectomy group.
Okay.
Yes, sir, for all the patients. Yes. Sir, chronic on AGM, like peripheral iridectomy was done and was on anti-glaucoma medication. And then minimum AGM we used 3 plus or minus 1, that minimum 4. Then after only that we planned for trabeculectomy or phacotrabeculectomy.
Okay. Thank you.
Thank you.
Thank you. You can collect the certificate.